Welcome, I'm so glad you all could join me. I'm Chavah and you're watching Ask a Midwife. Hey everyone, welcome. This is Chavah Benzion and you're watching Ask a Midwife. Today we're going to be talking a little bit about babies' movements and how do you know what's normal and what can we tell about the baby's well-being through the fetal movements. So when are we going to feel the baby moving for the first time? For different women it's different. The placement of the placenta on the inside of the uterus, whether it's in front or behind the uterus, whether it's placed on the anterior wall of the uterus or the posterior wall of the uterus, it can have an influence as to when we feel our baby's movements. If it's in the front of the uterus, we're going to feel those movements a little bit later than we would if the placenta was on the back. Either way, it's just a variation of normal. So you're going to notice that if you're a first-time mom, you might have to wait longer to feel those baby's movements. If you've had a baby before, you might feel those movements earlier on. It's normal from about 16 to 21 weeks to feel baby's movements for the first time, but if you are heavier set, you might not feel them until later. If you're slight, if you're slender, you might feel them earlier, just depending on where the baby's, implanted in the uterus. It also might have some bearing on that as well. So either way, there's a wide range of normal as to when you're going to feel those movements for the first time. And it can be kind of, it can be a little bit anxiety producing, like when am I going to feel the baby's movements? When am I going to feel this baby moving? It's so satisfying when you finally do feel that baby moving. It's so validating. It's so reassuring. So I just encourage you, if you haven't felt your baby yet and you're still on the earlier side of your second trimester, which is after 13 weeks. So if you're still like 14, 15, 16 weeks, don't worry, I'm sure you'll feel the baby move soon. And when you do feel that baby, it might not be a lot of movement. It might just be once, and then you don't feel it for a few more days, and that's normal also. Another thing that's normal is to only feel the baby when you're lying down, and sometimes when you're sitting, just depending on your position, when you're quiet, not when you're moving around, not when you're walking or cooking or working in another in other positions, doing other activities. It's really, really common just to feel the baby moving when you're lying down, most likely at night. However, what's normal for baby's movements once you do start feeling baby move every day? In the middle of your second trimester, so let's say weeks 20 to 24, you're going to feel the baby probably moving every day, a few times a day, maybe more, but definitely a few times a day. As you start to feel the baby move more, you're going to start to feel the baby moving more. The baby's going to be getting stronger, so you're going to start to feel more vigorous movements. And some babies move, I like to say, like they're karate babies or they're martial arts babies, and they do more, jabbing movements and more vigorous movements. And then other babies are more like ballet babies or Tai Chi babies. They're more gentle and they have more graceful movements, right? So each baby is going to develop his or her own way of moving because he or she has his or her own personality. So every baby is different. So every baby is going to have the movements that are specific to them. Some babies might move more and some babies might move less. So that's okay. What's important for you moms is to get familiar with what's normal for your baby, because as the pregnancy progresses, you're going to be comparing what's normal for your baby to what's actually happening. So if your baby's a regular mover and you're getting lots and lots of kicks all throughout the day, and then one day you feel less and the next day even less, you're going to want to take note of that, because the fetal movements, the baby's movements inside of you, are the number one indicator of the baby's well-being. So we can find out how the baby's doing through the movements. That's your own tool to assessing how's your baby doing. Is your baby happy inside? Is your baby doing well? Is your baby getting what it needs? Is it getting nourishment? Does it have enough calories on board to allow it to be active and moving? Does it feel good? Does it feel well? So what a baby needs throughout the pregnancy is lots and lots of nourishment, right? So your midwife or doctor will be encouraging, hopefully, like we do here at our practice, encouraging you to eat regular meals with protein and carbohydrates all throughout the day. As you get more pregnant, you might need to eat smaller, more frequent meals rather than 3 larger meals. But essentially, in the end of the pregnancy, you're going to need to feed the baby, which is feeding yourself, as frequently as you'll need to feed the baby when he or she is born. So let's say once he or she is born, you're going to feed him every 2 or 3 hours. You need to feed yourself at least every 2 or 3 hours for that baby to feel well. Women ask me what's normal for them to feel regarding the fetal movement, and I explain to them that based on whatever's been happening is what should continue to happen. If an active baby should continue to be active, a more quiet baby doesn't need to become suddenly really, really active to be considered as doing fine. Generally, if a mother notices that her baby's movements have decreased, I encourage a good meal of protein and carbohydrates, and then to reassess by lying down and assessing whether or not the woman feels the baby move. Of course, it's important to call your care provider if the fetal movements have decreased. It's important to check in with your midwife or your doctor if you really feel concerned about your baby. But in general, the baby will tell us how she's doing through her movements. So it's really, really important to pay attention. I don't subscribe to the idea that baby needs to move a certain number of times per day. I like to subscribe to the model where we pay attention to what's normal, and that way we'll be mindful and aware if something veers off of the course of what's normal and for our babies. So in general, if your baby's been really, really active that night, then the following morning baby's been really quiet and baby's tired from the previous night of moving. If the baby's slowly decreasing movements over 1 or 2 days to where you don't feel much at all, that would be a really important reason to get checked right away. Babies should always move a minimum of 2 play times per 24-hour period. So if your baby is really active late at night, there's probably another time in that 24-hour period where the baby's also active, maybe in the morning after breakfast. Generally, there's going to be 2 big play times a day in that 24-hour cycle, as well as other sort of assorted movements where the baby is adjusting him or herself. Sometime in the 3rd trimester, you're going to notice that those movements, which were once very vigorous and jabby, are now more like rolling movements instead of big leg or arm movements. They're more just adjusting her position, and that's normal. So at some point, the movements, they don't decrease in their frequency. They just change. The quality of the movements change. The type of movements, the way the baby's moving has changed because the baby doesn't have as much room as she once had. So her movements will change, but not necessarily the frequency. So she should still be moving as much as is normal for her, just with the knowledge that she's moving differently because of her situation inside the uterus. She just doesn't have the same amount of room. So that's really common, normal, and you can expect that to happen. So it's really common to worry about how your baby's doing. It's really common to be preoccupied even with the well-being of your baby. Some women want to go out and buy, devices that they can hear their baby just so they can feel reassured. Other people feel really compelled for multiple trips to the doctor, for repeated ultrasounds, just so they can see that the baby's okay in there, and they want that feedback from their care provider. Yes, your baby's doing well. And what I'm giving you is a little extra tool so that you can say, the number one indicator of fetal well-being are my baby's movements, and my baby's moving well. And so I feel reassured. I feel empowered knowing that if my baby wasn't doing well, I wouldn't be feeling all these great fetal movements. So even when you're awake at night because your baby won't stop moving, because you finally stopped, essentially rocking him or her during the day, when you're moving around, you're giving that baby almost just like a little rocking. And then when you go to sleep at night, your baby says, "Hey, what happened? Who stopped rocking me?" And then he starts to move. So you're awake and you're noticing, wow, this baby is moving so much, it's hard to sleep, it's hard to get comfortable. Those are all really reassuring experiences. So I just want you to take that and understand and see it for what it is. It's a good indicator of fetal well-being, and you shouldn't worry. In general, you should just always check in with your baby, always ask your baby, how are you doing? Are you hungry? Do you need anything? And make sure you've been eating and drinking well, and that as long as you're having really good fetal movements, I think you can, for the most part, be reassured and take heart that your baby's doing just fine in there. And I hope this helps you. And I hope that you look forward to seeing more of my videos and enjoying more of what's available here on Ask a Midwife. I hope you like this video. I hope you subscribe. And I hope to be able to bring you more content in the future and answer all your questions. All right, be well.